In this video, I'm going to start talking about the elements of the skeleton that you need to know. So not everything on the diagrams in the book is going to be included in this list of things that you need to know. So you should make sure that you look at your Canvas site, and there should be specifically the bones that you need to know. So we're going to start talking about the skull bones, and the skull is kind of interesting because it consists of two different types of bones. We have what is referred to as the cranium or the cranial bones. And these are the flat bones that make up the skull here and actually help to protect the brain. So these protect the brain. You'll remember that skull bones are part of the axial skeleton. So this axial skeleton includes the skull, but it also includes the vertebral column, the thoracic cage, which includes your ribs and your sternum, and the sacrum, which is the bottom of your vertebral column. So the skull bones are part of the axial skeleton. So we'll put axial in parentheses here, the axial skeleton. We also talked about how some of the bones that we have in our body are flat bones, and they're formed in a specific way, and they have a specific histology to them. So that would include the cranial bones. The cranial bones actually have suture joints between them. And so these suture joints are important because when we are born, the suture joints are more mobile. And then as we become adults, they fuse to form the skull. So when we look at the cranial bones, there are many different angles and perspectives that we can look at these cranial bones from. So the cranial bones include the frontal bone, which is your forehead. So this would be the frontal bone right here. And you'll notice that there is only one of those. We also have bones on the side of our head. So if we look at another perspective, these are referred to as the parietal bones right here. And then this would be the frontal bone. Why are these considered different bones? It's because you can see here that there is a separation of these bones, and this would be an example of a suture joint. So this particular suture joint is called the coronal suture, because that is where you would put a crown on your head. If you were wearing one, it would go over the coronal suture. We also have the temporal bone, which is an interesting bone because it has these projections, and it also has these holes and this knob right here. This hole is your external acoustic meatus. And so this is going to go into your ear. So your inner ear is inside the skull where it's protected. We also have this knob that you can feel at the bottom of behind your ear, at the bottom of your skull. And that is called the mastoid process. These are things you don't need to know, but I'm pointing them out because they're kind of interesting because we can palpate them on our body. So the mastoid process is this enlargement right here. And there is a neck muscle that extends down and then connects to your sternum and your clavicle. And when this muscle contracts, it actually pulls your head forward into flexion. Okay. This also has a extension here. This is again still the temporal bone, so it's a cranial bone, and it is going to connect to a facial bone right up here. So this facial bone is not a cranial bone, but rather it is part of the skull that helps to protect the eye. So it makes up the part of the eye socket. We also have in the back of the skull the occipital lobe. So that right there is our occipital lobe. We could do a mid-sagittal section through the skull, and we're going to talk about, let me get these erased. We're going to talk about these spaces in the next lecture, which are referred to as sinuses. So when we think about our sinuses, you might just think about like your ethmoid sinuses, which are right up here in your nasal cavity. But we also actually have sinuses deep in the skull. And so we'll talk about those in another lecture. So those are the skull bones that you need to be able to identify. So let's write those down. So the cranial bones include the frontal bone. So it's frontal bone. We have the parietal bones because there's one on each side. You need to know the temporal bones, which are near your temples, right? And then we also need to know the occipital bone. So let's look at the facial bones. Let's see. So we have facial bones. And again, we're not going to, you're not going to need to know all of these facial bones. But one facial bone that is important is the zygomatic bone. I mentioned that as being or making up part of your eye socket. This is your cheekbone. We also have the upper jaw, which is your maxilla. We also have the lower jaw, which is the only part of your skull that is actually mobile, and that is referred to as the mandible. So this is my lower jaw. We'll talk about the roof of the mouth. The largest portion of the roof of your mouth is actually the maxilla, it's the upper jaw, but then we also have these bones called the palatine bones. So the palatine bones make up the roof, part of the roof of the mouth. And then you might also note that we have nasal bones. So that makes up the bridge of the nose between the eyes. So let's just look at some of these bones. So this one right here is there's actually two of them. And this right here would be the nasal bones. This is the zygomatic bone in orange here. This is your upper jaw bone. And this is your lower jaw. We can look at it from the side. So we can see here that the lower jaw, the mandible, actually articulates with the temporal bone. And this is what produces a joint called the TMJ, which we'll talk about in another lecture. So that is the temporomandibular joint, or TMJ joint. So I, for example, have problems with this joint. It causes pain. My jaw is tight and it clicks sometimes when I open it, and sometimes I can't open it very far. So if you have TMJ syndrome, that causes problems with this particular joint. When we look at the palatine bone right here, it's better observed from a different perspective right here. So this is just removing the lower jaw. So we see here that this is the palatine bone. And then you'll notice, this is not related to the facial bones, but I forgot to mention that this is the opening that allows the spinal cord to come up and connect with the brain. And so that is actually in your occipital bone, and that is a foramen. So that is a hole in your skull that is at the base of your skull, which connects to your first cervical vertebrae. Okay. You'll also notice that there's other foramen because blood vessels and nerves have to be able to travel in and out through the skull. So those are fundamentally the different parts of the skull. There's one more bone that I wanted to talk about, which is a very interesting bone from an evolutionary perspective, which is called the hyoid bone. So you notice here that it's actually floating. It doesn't have a direct articulation with a muscle. It actually connects via a connective tissue, like a ligament, from this styloid process down here. and it actually aids with the depression of the low jaw and the movement of the tongue. So this hyoid bone is interesting because it is believed to be a leftover gill bone. So when we undergo embryonic development, we have these pharyngeal gills that then become modified to do different things. So for example, our jaw is a modification of a pharyngeal gill. And then this one is left over. So this is like a gill arch in a fish. Okay. So those are the skull bones and the including the cranial bones and the facial bones.